One in three South Africans suffer from mental illness, with 75% unable to access treatment. This is largely due to medical facilities being under-resourced, but also the stigma, which is a persistent deterrent for seeking help. We have online with us Dr. Sibolelo Siepe, the President of the South African Society of Psychiatrists. Dr. Siepe, good morning to you, and thank you for joining me on the program this morning.
Good morning. Can we just correct that? I am the past president.
The past president
of the South African Society of Psychiatrists. Yes.
Thank you for that, and sorry for that mistake. Now,
no problem.
Dr. Siepe, how do we define mental health? What is mental health?
Well, mental health really, it is a long, complicated, definition, but it is that state of, first of all, not having a mental illness, but it is beyond that, where you have mental comfort and capacity, where you are in charge and in control of making decisions, of making assessments, of being able to look after yourself, and to know what is necessary for you. It is not just not to have an illness. No, it is also peace of mind. It is also being clear, being functional, fully capacitated to function with all your mind.
Mm-hmm. Now, having said that, how are the facilities in the public sector for assistance with mental challenges, if I can put it that way? I don't want to call it. I don't want to call it a mental illness. But
sorry, I didn't get the question.
The question was: are there any facilities in the government sector, and is this situation being addressed by the government sector? And if not, why not?
Well, okay. In terms of the government sector, there are facilities. If we start at the top, there are hospitals at the top, and all different levels of hospitals, from quaternary right down to regional hospitals. But more important, and what we really need the most of, is community. It will be the first and primary centers for people to get mental health care. There are facilities. I won't say there are none. Yes, there are, but not as plentiful as the population requires, number one. And number two, they're not as well resourced as the population requires in terms of having all level of mental health care practitioner. Because remember that the doctor is not the mental health practitioner. It is a range of mental health practitioner service providers, which would be from doctors, nursing, occupational therapists, psychologists, social workers, nurse practitioners. And indeed, we should now be getting into a point position, which we haven't gotten into at all, where we are using other members of the public who should be then, shall we call lay public at best, who should be capacitated and upskilled to help the mental health care team, because we have a huge burden, who could be out there in the community seeing with basic skills to be able to pick up people who might be having mental health care conditions and bring them in, and or just be there to help them in terms of taking their medication, looking after themselves, and all those type of services that we don't have, that we should have, which should be linked to the primary healthcare team.
Mm-hmm. Now,
and in terms of, if you go to the highest, as you go up the levels of hospitals, there are never enough mental health care beds, never, ever, ever. So at whatever level of hospital you're at, there are fewer beds than is necessary.
Mm-hmm. And what about?
It is a problem in itself. But of course, we'd like to devolve the mental health care to the bottom levels. Sorry, we keep interrupting each other.
No, not a problem at all. In fact, I was just going to, you actually preempted my question by answering those. But just to get back, are there any measures that are being discussed or implemented to improve access to mental health services at the community level?
Yeah, you know what? Definitely things are being discussed. I cannot say things are being discussed. Are being implemented. We have had, the societies of psychiatrists has had plenty conversations with stakeholders and government. We will continue. But, government is a very slow instrument. It doesn't seem to work very, very quickly. But we are always trying to say how best to serve people. In terms of professional help, the numbers are far too little. But We should be training, upskilling all other members of the mental health care team, really, that should be able to do this. And you are finding that, yes, implementation is slow. We are finding a lot of help from advocacy groups and self-help groups and support groups, and to try and at least keep people in the best possible mental health, to support each other, especially the support groups are usually of patients only, or people with mental health conditions. But we do, want to help them. But in terms of implementation, in terms of having enough professionals at that primary healthcare level, has not really taken off in any great way, and even other facilities that would lessen the burden on the professional teams, like halfway houses, we are not doing great, and all the halfway houses that are available are actually not state-funded half houses. They would be private associations and organizations. So from government level, it's going slower than we would expect and we would need it to.
Okay, there's two questions that come up from what we've just discussed. Firstly, you refer to halfway houses. What are halfway houses? And secondly, you refer to a mental health team. Now, besides psychiatrists, who's involved in this in this spectrum?
Okay, the narrow team, I repeat, a very narrow team, and the one that we don't think is going to bear us all the necessary fruit we need, would be what we call the professional team, which would be like psychiatrists, psychologists, occupational health therapists, social workers, nurse practitioners. That is they're a very narrow team. And obviously anybody else who might need to be there. By anybody else, I mean if a mental health care user also has pneumonia, would need a physician, So those would be those who come in and not necessarily be core team. But what we are saying is that the team is actually much wider than that. Mental health care users are not just independent souls floating about. They are family members. They belong somewhere. So the family is part, or at least a caregiver from family side is part of the team. The community is part of the team, because we expect the community to be aware, to be understanding, to be helping where they can. We also want people to join the team, as I said earlier, lay people who would be upskilled, because they are there in the community already, seeing who has a mental health issue, needs to be referred or needs to be helped, or needs to be, sometimes the lay team is not just helping with taking people to the clinic or making sure they're taking medication, but is helping them to access other resources they need, like a grant, a social grant. So they'll be there to help them in that way. So the team is actually quite broad. And even you in the media are part of the team, so that you can help us spread the word, so that you can make of certain things. And all these things we are hoping would get people into better mental health care, would also decrease stigma, because that is an enemy in the system. Because lots of people are not openly maybe going for treatment because of stigma. People see me going to the clinic, so I won't do it, or see me taking medication, so I won't do it. So the team actually is broad, is big, and if all of us as team members actually participated, we would achieve a lot in terms of helping people's mental care users, or mental health care problems, in terms of bringing people who need to be brought into the system, and in terms of trying to keep as many people out of hospital, well treated and living full lives in the community.
Dr. Sepa, the other question I posed to you was, if you could just explain to us what are halfway houses that you refer to, please?
Okay, halfway houses. Okay, sometimes you'll find that somebody, I will put it in that example type way, somebody with a serious mental health illness is not, should not be kept. What we try and do is that people should be treated close to where they stay and should go back into their lives and communities as soon as possible. So you might have somebody who remains maybe, let's say, with a psychotic illness and remains psychotic and is not fully able to look after themselves independently, or also the family is not able to, or has no one to look after them. So they should not be in hospital setting 100%, but they also can't live independently at home or in the community. So they are housed in a an institution, let's call it. It's not the right word, but let's call it that, the halfway house, where they are looked after. There is care enough for them in terms of whether it is just to get medication or whether it is to sleep and have meals, or whether they can actually even access their jobs but come back here to this caring place where they can be kept contained. So they're not fully free, shall I call it, or symptoms in terms of their severe illness, but they also don't need to be in hospital. You know, that is this function of a halfway house, where you are not needing to be in hospital, but maybe you're not yet ready to stay independently at home.
Thank you for that, Dr. Sepe. And let's talk about technology. How is technology? Hello, can you hear me? Can you hear me, Doc?
Yeah.
Okay. Let's talk.
I'm in load shedding, so it's a bit of a nuisance.
I can understand. Tell me, technology. In what ways is technology being leveraged to widen mental health care on a community level?
Yeah, technology can be very, very useful, and we should all be trying to use it more and more, because now we have come to know that how useful it can be. You know, if from the start of having, you know, like podcasts and even on simple things like TikTok and things like that, where there could be a dedicated channel, a podcast that delivers mental health messages, or a group that informs and teaches and alerts people. That is already technology. Beyond that, there is also a lot of applications that are online that deal with that. Sometimes you'll find they have an application that looks at people and, let's say, substance abuse, and they have an app that then starts to question, let's say, poses like a survey for yourself. You know, it's a self-help thing, and then it says, if this is happening, if this is happening, if this is happening, then seek help in this way, or that says, these are the facilities you can attend. And I mean, it's not just about substance abuse, it's about even just depression or dementia, or that there are apps that you can look at and follow and see where do you need to, you know, if you need help and where you can go to. It can be a very useful adjunct. And of course, just as I say, the biggest thing that I think would help people was if there were lots of, whether on TikTok, on Twitter, on any form of social media, where mental health conditions are described and people can listen and look and see if they fit, if they know somebody else who fits, and if they should seek help. So we should be using it more often than we are. And sometimes also, it would be useful. Sometimes you find that people who are really, really not doing great and maybe are suicidal, and they post things whether on their podcasts or even in songs or in their messages, and somebody's able to read it and then find them and get them, you know, take them to help. You know, and artists are there also making songs and poetry and things, both to spread the message, and sometimes if we should be listening properly, so that actually the messages that the artist is producing is saying he is not doing well or she's not doing well, and how do we then get in and help? Yes.
Dr. Sibulelo Sepe, thank you very much for joining me in the program this morning. Unfortunately, we're going to have to leave it there, but before you leave us, do you have a message for our listeners?
Yeah, okay. I didn't have a message. I always should have a message for my listeners. Take care of your mental health. Be comfortable to seek help. Talk to somebody from your family to community. Be comfortable to approach your community health care center. Be comfortable to approach your doctor. It is okay not to be okay. We are not machines. Even machines break. And we will take stress from time to time. And we should remember that a mental health illness is like any other illness. You know, when somebody has diabetes or high blood pressure or the arthritis, they don't hide it, and it's not a secret, and it's not viewed in a negative light. Instead, we all help them. Same with the mental health condition. It should not be a secret. Please be out there and get help. And many of the conditions we are able to contain.
Dr. Sepe, thank you very much, and enjoy the rest of the day. And thank you for joining me in the program this morning. All the best to you.
Thank you so very much.
We spoke to Dr. Sibulelo Sepe, the past president of the South African Society of Psychiatrists, and she spoke to us about mental health and how to take care of ourselves and how to create an awareness. You are listening to Rise and Shine on Radio Lansar with myself, Faisal MJ Suleiman.